Harris Health is well known for its excellence in emergency care, operating two of Houston's busiest and most renowned trauma centers. What's not as well known is that Harris Health is considered among the nation's best hospitals in cardiac care. One way quality cardiac care is measured is a hospital's door-to-balloon time. How quickly can the emergency center diagnose a heart attack and get the patient into the cath lab?
And everyone knows exactly what their role is when a patient comes in having a heart attack.
Dr. Nasser Likas is Chief of Cardiology at Ben Taub Hospital.
We created a program where we were able to open up these blocked arteries in the setting of a heart attack in the shortest possible time. Actually, our data shows that we're among the top hospitals in the U.S. and the speed in which we open up blocked arteries in heart attack patients. Compare this to that. This is 95%. This is open completely.
That level of performance has earned Harris Health the Mission Lifeline Gold Plus Receiving Center Award from the American Heart Association for its care of severe heart attack patients. The Harris Health Comprehensive Stroke Center has also added to the acclaim. The center has received the American Heart Association's Gold Plus Award for the last 4 years. Neurologist and stroke specialist from Baylor College of Medicine provide the highest level of care for stroke patients. As one of the nation's largest public hospital systems, Harris Health is at the forefront of what's being called value-based care, where the best outcome for the patient and the patient's safety are the top priorities. Dr. Perk Sheth-Baber is Chief Medical Officer for Harris Health.
Quality of care is important because, quite simply, it's the right thing to do. When we treat patients at the right time with the right treatment, we get better results. Quality of care may reduce readmissions, it may reduce complications, and may reduce the hospital-acquired conditions. Ultimately, we would like our patients to return to their baseline quicker.
When Harris Health was founded 50 years ago, the core mission was the same as it is today: to ensure everyone in the community has access to the highest quality of care available. Each year, Dr. Baber and his team raise the bar a little higher, establishing quality initiatives for the entire Harris Health system.
The three main quality initiatives for 2016 are hand hygiene, timeouts, and promoting a just culture. We feel with these three projects, we will embrace quality, provide better outcomes, and better experience, not only for our patients, but for the entire Harris Health community. There's been many reports that shows that patients actually die from hospital-acquired infections and condition. It's paramount to patient safety that we use this simple yet powerful technique of washing our hands.
A government study found that inadequate hand washing caused nearly 250 deaths a day from preventable hospital-acquired infections. The annual cost to U.S. healthcare is estimated to be nearly $10 billion. While this new emphasis on hand hygiene will not completely eliminate these infections, it's a powerful tool in significantly reducing them. While this movement to increase the quality of care can save lives and money, it really doesn't require big capital expenditures. What it does require is a new way of thinking.
It's not so much about money as it is about culture. For example, hand washing.
Dr. Michael Gardner is Executive Vice President of Harris Health and in charge of the system's ambulatory care services.
In all of our clinics, in all of our hospitals, and you can't go more than 10 yards without running across some way of washing or cleaning your hands. So that does not require a capital expense. We can afford soap. Okay? What that requires is a cultural change where everybody, from the CEO, the medical students, housekeeping, and everybody else that has any kind of contact in any way with the patient remembers that when they go into a room and when they come out of the room, they wash their hands. That is a cultural change.
Part of that cultural change is moving towards what's known as a just culture, another of Harris Health's current quality initiatives.
A just culture is everyone feeling equal and part of the team, so that no one feels like they will be punished or get in trouble if they speak up. Again, to me, it's all about teamwork.
Dr. Peter Doyle is Chief of Anesthesia and the OR at LBJ Hospital.
Well, I've been a big believer in, I haven't called it just culture, but in treating everyone in the operating room the same. I'm on a first-name basis with the people who clean the OR. I talk to them like I talk to other faculty. I'm setting the example that in the OR, anybody can say anything if they have a concern, that they're not going to be dismissed, that they're not going to be yelled at. Everybody has an equal stake in quality in the operating room.
All right, are we ready to time out?
In this new culture of quality at Harris Health, a busy operating room comes to a complete stop before every procedure as doctors, nurses, and technicians run through a timeout, their medical version of a pre-flight checklist, double-checking the patient's identity, diagnosis, and details of the procedure.
It was considered by some unnecessary and maybe even controversial that we were going to stop before every operative procedure to do the timeout, to make sure that we have the right patient, that we're doing the right operation, that we're doing it for the right indications, and if it involves one side or the other, on the right side. Now I don't think anybody would dream of doing a surgery without doing a timeout.
A culture of quality is an ongoing process of analysis and improvement. It's not a matter of setting a goal, achieving that goal, and then moving on. In healthcare, the bar should be constantly set higher. And for the people of Harris Health, quality care is second nature.
And no one thinks anything about it because it's part of our culture. But I think when people are part of that, and particularly when they're raised in that culture, it becomes second nature. We wash our hands, we do timeouts, we double check identity, to make sure we're not giving the wrong medication to the wrong patient. That's not open to negotiation, that's not open to interpretation, that's what we do here. That's our culture.
The entire team at Harris Health System takes great pride in providing quality health care. It's the sole reason why we get up to go to work every day. We are very committed to the mission to get the best quality care for our patients and our community.